Welcome back, everyone. We are in the gym, and we're talking about living longer and looking younger. It used to be that living until retirement into your 60s was a good thing, but now folks are living into their triple digits, and so we are trying to stay young around here, obviously. Dr. Walter Gaman joins us with a look at genetics and how important they are, because we talk about that all the time, you know, having good genes and whatnot.
Absolutely, and it's the future. You know, Watson and Crick discovered the DNA chemical in 1964, won a Nobel Prize. Just 2003, we decoded the human genome, the human genetic code. It will go down in the history of mankind as the single most fantastic thing that ever happened. And you know, Steve Jobs, a couple of years ago, he got his DNA decoded. I think it cost him $1 million.
Okay.
Scientists at Harvard are trying hard to drive down the cost to less than $1,000. So that you, Scott, will be able to have your own DNA decoded, your own genome decoded. It'll be part of your medical file. Your doctor will be able to look at it. He'll be able to say, Scott, you're allergic to these things. You don't have to try them to find out you're allergic.
All by looking at this code.
Absolutely. And he'll say, you know what, you've got this infection. This is the right antibiotic. The DNA code says you should take this antibiotic. So we're going to have less complications, better results. We're going to drive healthcare costs way down. I mean, we're going to look back at the pre-genome days as barbaric. We're going to say, we can't believe doctors used to practice this way. It'll be unbelievable.
Well, you know, you mentioned Steve Jobs and him decoding his genome, but he ended up dying. I mean, it wasn't very old.
No, but he already had pancreatic cancer, so I mean, his was sort of a vain attempt to try and pull something out of the hat.
Yeah. So when do you think something like that will happen?
It's happening.
As far as making it affordable for folks, though?
In the next 5 years.
Really?
We are on the cusp of a huge revolution in medicine. Huge. It's unbelievable.
What do you do to be younger, to feel good?
Yeah, you know, for anybody, there's a number of things. Some of them are old hat, you know, being lean. You know, the British royal family, they've known for hundreds of years, be lean over the age of 40. They restrict their calories, and that's proven to keep you younger. That actually lengthens your telomeres, as we discussed before. Exercise, of course, something you're a fan of.
I love exercise. I think it's the most important thing you can do, and I think I can say that I'm in better shape now than even when I was in my 20s, but you really have to work at it, though.
You really do. Getting enough rest. You have to rest, especially if you exercise. And you have to get enough sleep, something you have a hard time getting, but that's what you need to do. And then you have to have right nutrition. I mean, you have to have right nutrition. You need to have the right blood test to see that you have the right nutrition, and if you don't, alter nutrition or take supplements. And then, you know, at Harvard with the David Sinclair group, they tested resveratrol, you know, the chemical found in the skin of red grapes. And they found in animal models that it extended life 2 or 3 generations. So I know that Big Pharma is actively looking for drugs. This will be the holy grail. Just imagine, Scott, you can take a pill and look as good as you do today forever.
Forever? Wow. I better do something about that bank account so I can live forever. Thank you, though. Seriously, it's really good information to know, and that's really exciting news about the genome. So we appreciate the info this morning.
You're very welcome.
All right.